Hello everyone, and welcome to Precision Neuromuscular Therapy for the lower extremity. As you see in this video, the client is explaining to me the discomfort that she feels. She has plantar fasciitis symptoms and some tightness in her gastroc and soleus, and so now we're doing length testing. And then quickly we're on the table doing work, first examining the medial head of the gastroc. There are several purposes to this video. First and foremost is to show you how you integrate the assessment techniques right into the table techniques, and that it's a seamless integration rather than having the assessment techniques all front-loaded while the client is patiently waiting for you to, as they think, begin work. In the way we do precision neuromuscular therapy, the assessment, the technique, is all blended together into a seamless, coordinated, transparent dance that is both pleasant for the client to receive and also challenging and fun for the therapist to perform. Here I'm doing some stretching, pin and stretch techniques for the gastroc and soleus, mostly soleus at this point because the knee is bent. And notice again, in a clinical situation like this, rather than being fragmented, as you learned in the seminar, all these different pieces in one after the other, now another purpose of this video is to show you how you can bounce back and forth between one technique on one muscle and then switch to the soleus or switch to another muscle. Now, having her lie prone, I can use just a tiny little bit of lubrication, and we'll start again with some pin and stretch techniques for the gastroc. Notice her foot against my thigh. And I'm adding just a little stretch. The knee is straight, therefore we're treating the gastroc. The third purpose of this video is to show you the speed of the treatment itself. Notice the hand speed is very, very slow. One of the things I consistently notice in seminars is that people just move too quickly. And if you move quick, there are two problems with that. Number one, you tend to miss a lot of these little intrinsic places that we think are important to examine. And number two, a quicker motion tends to be stimulating for a muscle. And if our purpose is to quiet and lengthen tightened areas, then stimulating it probably isn't the best choice. So the work is very slow and very thorough, very precise, which also for the client then is extremely relaxing. The point here is that great work, really precise work, really thorough, therapeutic work can also feel incredible. If the client doesn't have a wonderful experience, then it may be therapeutic, but they're not coming back. We don't believe that therapeutic work is on an opposite end of the spectrum from work that feels great. We believe that work that feels great can be therapeutic. It's all about precision, not pressure. Here I'm examining the Achilles tendon attachments of the soleus. She will turn side lying again. And now I'm going to look at the fascial area of the foot and address the plantar fascia itself. As we said in the seminars, this is never done in an aggressive, straight-on way. Because the nature of plantar fasciitis means inflammation of the fascia. To dig straight in on the fascia is only to create more inflammation. In the way that you learn in the seminar, we use classic myofascial techniques to deal with the fascia. Transverse juxtaposition, longitudinal stretching. Now at this point, this is addressing the quadratus plantae, gliding into the calcaneus. This is the abductor hallucis. Notice the thumb assisting the finger, a very easy way to treat, and you can see how much pressure I'm using. This work is very, very easy on your hands. It's about precision, not pressure. Now I'm following the abductor up. You can see each time I do that, I don't know if you caught the little movement of the big toe. This is now the adductor hallucis. Transverse head. Using a little movement now, and this is the oblique head. Going back to the plantar fascia yet again, transversely. Always moving from one technique to the other in a seamless integration. Very clear about what our purpose is, what we're treating, why we're treating it, and what we expect to happen after that treatment. Enjoy.